It is my pleasure to introduce Nick Cappoletti, Chief Executive Officer for ACANY and Life Plan CCO.
Thank you, Nadira, and good afternoon, everyone, and thank you so much for joining us. We know we're quickly approaching the end of the year. We know how busy you all are, and hopefully the content that we'll share with you will be of value. We want to, first of all, as Nadira said, thank you all for being our valued partners. Without all of you, we couldn't coordinate the services that we do for our members. Together, we have a joint interest in improving the quality of life for the people that we serve, helping them lead the healthiest lives possible, helping them connect with their community, helping them achieve the goals that they all want to pursue. And I personally wear the hat as parent and know how valuable our provider partners are. I couldn't be here without a partner supporting my son. So thank you again. We have been on a interesting journey over the last 5 years as care coordination organizations. First couple of years were challenging to stand up the organizations to transition the MSC workforce, to hire many new people, and to really try to work with OPWDD as well as all of you in fine-tuning the whole life planning process, which, as you all are aware, was basically fairly new as well to care coordination. It had changed from our former ISP planning process to the life plan planning process, which brought a significant number of challenges, both from a standpoint of implementing the life plans, making sure the goals were what we needed them to be, and then coordinating all the other collateral documentation. So first 2 years was that startup, and then we had the COVID pandemic, which caused all of us, especially all of you, significant challenges in supporting people through what was a very difficult time. And then the last year, we've been slowly sunsetting the PHE. So we have, really tried to coordinate the activities between Life Plan and ACA, two separate CCOs serving really different geographies, but working collaboratively to really improve the quality of care management, the service to our members, the work that we do with all of you. One of the first things that we did about a year ago was to implement a provider relations model. We had started doing it in early stages with Life Plan, but then extended it to ACA. And really the whole intent, and I'll get into this a little bit later, was to ensure that we were coordinating our efforts. We as CCOs have a lot of demands, regulations put on the care managers as part of their job, and sometimes we can be have a little bit of tunnel vision when it comes to how do we best perform our duties. And it's really a team effort, and we need to be able to do it in lockstep with all of our provider partners, be them healthcare partners, because an important part of the job of the care manager is to identify the member's health needs and link them with the appropriate services. But then certainly long-term support services, waiver services, you are all valuable partners in that. And then we also have many community partners who are not waiver providers, but provide housing, food security, and all the other supports that many of our members, especially those who live in the community, rely on every day. So again, we want to kind of share our first year at really this focused effort in engaging all of you. I know I've been in a number of roundtables and meetings with many of you. We are provider led. Our boards are providers, so we hear input from them, but also we wanted to make sure that we were out in the different regions for both ACA and Life Plan, and hearing what's working, what's not working, engaging with our care management team, who is also very dedicated to enhancing provider relations and serving our members in a coordinated way. So we're going to share some of our activities as we look at the agenda that we've had. We're also going to discuss some of those challenges that we've got. We're going to talk a little bit about some initiatives that we have moving forward that we have either on our own or together in implementation with all of you, and then talk a little bit about our advocacy activity, which we have done, because we've been able to, one of the things that differentiates CCOs from when we have Medicaid service coordination is just for Life Plan and ACA, there was several hundred agencies throughout the state that were coordinating care. As we know, there was probably 350 MSC agencies, and nobody really took a global view of some of the challenges, both in the regions as well as statewide, as to what was negatively impacting people's lives, how we could best coordinate that. So that has led to a lot of advocacy work on us that I'll discuss a little bit later. Let me review some of the key activities that we've been able to perform over the last year. And if I could just ask if you could advance the slide. This is just kind of, I'm not going to go over each one of these line items, but this is just kind of a quick recap of a lot of the activities. So we have 3 provider relations directors in the ACA geography, 3 in the Life Plan geography, and they're under the leadership of Lori Kiersing. And really, we've tried to ensure that they are partnered with our care management team, the regional leadership, and the CCO leadership, to ensure that we were coordinating a lot of these activities. So many individual meetings, and we appreciate the time that you've spent with us in not only educating us on your work to support members, but then also hearing what works and what doesn't work as we try to collaborate and work towards a common goal in supporting people. We did a number of regional fairs, provider fairs, which I know we've gotten lots of positive feedback from all of you. Had hundreds of agencies participate, over 1,000 care managers. And really, this is kind of back to normal, if you will, activity, because with the turnover, both at the agency level as well as at the CCO level, many of our staff did not know one another. They may not have been as familiar with the programs. Some of your staff may not have been familiar with care management. And so having these provider fairs was important to, again, being able to connect people, but then also make the care managers aware of your programs, what you were doing, and ensuring that we knew that as we coordinate care, not only for our existing members, but the new members that are coming in. We've done a number of webinars, and again, great attendance on your part. We appreciate that. Again, we maintain provider relations pages on both ACA and Life Plan websites. For those of you who have not heard us talk about the community resource tool, this is a tool that we have built because one of the most important things, obviously, is to have a qualified care manager who understands people with IDD and can do the person-centered planning process, but they need to be aware of what resources are in the community. And the community resource tool really has allowed us to, and this was created initially by Life Plan, some of our member and family advisory council members and parent liaisons who actually helped us develop this. And now we've expanded it to both CCOs to really be as a resource or a guide as to what services are available. We've got dedicated resources building that out in each geography. We're hoping that we're going to be able to extract a lot of the information held in our EHR to complement this, things like dentists and medical providers and respite and recreation, so that not only our members and families can access this, but also you all can access it and ensure that you're listed and we have information on your programs for them. We've done the newsletters. Certainly a lot of focus and interest in the unwinding of the PHE and some of the directives that we've gotten from OPWDD. And then again, we've really enjoyed the opportunity to participate in all the major provider association conferences, both as presenters, sponsors, and attendees. If we could advance the slide, please. You know, in our travels, both my travels, last week I was on Long Island talking to providers, almost weekly. This morning I had a meeting with several providers talking about the system, what's working in the system, what's not working in the system, how we can jointly solve issues and challenges. And we have heard through both that activity as well as through our care management team, some of the challenges that you all as providers have been experiencing. And again, we want to make sure that we have positive, constructive collaboration, that we are doing the best as we create person-centered plans to implement those plans and make sure our members are getting the supports and services that they need. So a couple of the areas that were identified, we've listed here: timely receipt of life plans, care manager transition, provider maybe not knowing who the care manager is, making sure that we're giving people enough time to put the life plan on the schedule and make sure all the key members of the IDT are invited. Making sure that you have somebody, either the care manager or if not, somebody else to contact when there's an issue, an emergency. Obviously, that's not all just important to you as providers, but also to our members and family. One of the services that I think we provide is just being the resource or the repository of a lot of information about members. And so one of the things that we did early on is invest in an EHR. That was one of the requirements of CCO, but being able to give people the information that they need. And I know that's important. When I was a provider, that if for some reason you were missing a document, you need an LCD, you need a recent copy of the life plan, or even an older copy of a document, that there was somebody there to assist you. And so that was something that we heard. We're under the requirements of a very strict interpretation of HIPAA that the Department of Health imposed upon us as a pilot when the CCOs were created, and has never been relaxed, nor has it been extended to other health homes. So we have a very strict set of regulations that we have to abide by, but we'll talk a little bit about how we have been able to work that and make it so that you can get that access that you need. Certainly the person-centeredness, this is something that we all talk about, and we need to really focus on the person-centeredness of the life plans. I, as a parent, certainly experienced that. And I'll talk a little bit more about how we can potentially work. We've been giving OPWDD feedback because so much of what the care manager has to do is grounded in regulation and requirements, but we don't want that to take away from, the ability for, person-centered planning and giving a quality experience during that planning process. And then, lastly, obviously, is enhancing our support as we look at managing, complex people with complex medical issues, complex behavior. So based on a lot of your feedback, we've really implemented a lot of positive things, both in care management, and some of our care managers were absolutely sharing these same issues with us. And so with our partnership with ACA and Life Plan, we've been able to invest in a number of initiatives. So I just want to share a few of them. Our partnership is called Coordinated Care Alliance of New York, which is really jointly funded by both ACA and Life Plan, and has allowed us to really identify best practices and align our practices. While both CCOs are different and have different care management teams, we wanted to make sure that we had best practices regarding care management. And as we develop those best practices, some of the areas that we have been focused on in implementing both in policy and procedure is ensuring, that we address some of those issues that I just mentioned, making sure that there's adequate time to get the Life Plan scheduled, making sure that all attendees are invited, making sure that the Life Plan is created and issued in a timely way. So we have really not only taken best practices from both CCOs, but then also incorporated a lot of your feedback. We looked at where the CCOs, because again, all the CCOs kind of developed uniquely, even though we're similar organizations, but some CCOs did some innovative things, and a couple of the innovative things that both ACA and Life Plan did on their own that we thought were so good that we actually expanded them so that both CCOs would benefit is one is a call center. So ACA had started a call center. We were able to expand the use of that call center to both ACA and Life Plan. It provides people with a way to get a hold of us, to ask for information, to contact supervision if there's an emergency. There's backup to that, so 24/7 backup. And it's all using a tool, the best of breed tool, Salesforce, to ensure that any calls that we get well, and then our call center also does outbound member satisfaction calls, which when they're not receiving calls, they're actually making calls to kind of measure satisfaction. The call center may receive a call, like say, for instance, a provider in the Hudson Valley needs a copy of a Life Plan that they don't have, or they need a document because they've got an Omega audit going on. But the call center itself is not going to be necessarily emailing you a document because there's a consent process, and we need to make sure that there's authorization. And so Life Plan had developed a health information management office, and that had worked out very well for us in ensuring that we were compliant with the distribution of key information, the filing of key information, and then also making sure that when we did send information out, we had the appropriate consents. So we took that model and have expanded that to ACA. So now both ACA and Life Plan are supported by a health information management office, which is tied together with a call center. So if calls come in, the health information management will get ticketed. They can respond to those requests. If we get a large request from an agency, we have some agencies where we may co-coordinate 400 or 500 members. So in those cases, if they're under a major audit, they've got the resources and the health information management team to be able to focus on responding. They also ensure that care management is filing documents, things like trusts and guardianship and any other documents that are important to a person's life that we may have a copy of, that they're being filed in a way that we always can access that information. So it's not based on, the individual care manager deciding how to name a file, but we've got policies and practices that ensure that over the long haul, because again, we're looking at this long term, that we have comprehensive records of each one of our members, and that information is there regardless of change in personnel or change in family. We expanded clinical. We know it's very challenging to coordinate care for people who have medical and behavioral complexity. We have a very diverse population. And so we've expanded, we've added nursing, we've added behavioral health resources to that clinic. They can be called in to help the care manager problem solve. They are in the process of building relationships with everything from hospitals to other medical providers, so that if we run into somebody who has, or we encounter somebody who has a significant issue, we may not necessarily have the resource in a given region, but because this is a shared clinical resource, they may be able to do a referral. So if we have somebody upstate who needs a resource that we know of downstate, we can easily make that referral. Our clinical department also, for the first time, because collectively between ACA and Life Plan, we serve almost 45,000 people, is looking at trends. And are we seeing issues that are affecting people, the fatal five, other issues? Are we seeing health issues that we can potentially make a difference in through an intervention or through education? So they're very much focused on not only participating in provider activities, but also they focus on member and family activities to educate them on some key population health issues that we see. And they also provide us with a lot of information for our advocacy, because we know that there are significant shortages in primary, specialty, dental, behavioral health care. I was just in a meeting with the governor's office talking about, the unmet needs of the population and people spending far too much time in hospitals and emergency rooms and not being able to access the appropriate care that they need, which affects the services that all of you provide. We've made a significant investment in learning and development. And in 2024, we're moving towards care manager certification to ensure a consistent level of knowledge in practice amongst all of our care managers. And then shortly after certification, we will begin full implementation of specialization where it makes sense. And we've already started some pilots with specialization in the area of new enrollment. So when a person goes through enrollment, which can be a lengthy process, thanks, given some of the challenges of our front door and the overall system and getting all the documents and the eligibility, that when those people are ready to be served by us and when we do the initial person-centered planning, that is done by an experienced team who has knowledge, who specializes in new enrollment, and they can then work in making sure that we request the services the person needs and that those services applications have been done. And then there's a transfer to our general.
Hey, Lori, did Nick cut out for you too?
He did. He did. I know he was having problems in the beginning
Yeah, it
getting
looks
on.
like he's here.
Oh,
there.
there we are.
I was just gonna jump in, Nick.
Yeah, Jamie, please.
Oh, well, I was just gonna jump in because you cut out there for a minute, but you're back, which is great.
Okay, good. I'm sorry. So I don't know what part I cut out at because I'm not getting the cue.
You cut out, you were talking about learning and development, and all of a sudden you
Okay.
disappeared.
And
a little
again,
bit.
what I said there is that, we are moving in 2024, all care managers will go through certification, which is comprehensive training, role playing. It's going to be a look at their, how they coordinate care, a practicum, if you will. And we want to do that so that we have a consistent level of care management, which will then allow us to build on that and specialize. And we expect to begin rolling out specialization at the end of 2024. We've already done our initial pilot of specialization for people who are new to enrollment, to ensure that they're getting the kind of person-centered planning experience they need to be successful. And then we'll be doing that for other populations, and we'll share more with that in the future. And then all of this is being monitored with benchmarks and analytics. Could we advance the slide, please? So, some of the progress that we've made, a lot of the interventions we put in place as soon as we started, as soon as we were aware of them, and some of them we've known certainly through COVID that have been challenges. And just looking at the concerns that have been expressed by many providers from the beginning of the year to now, we've seen some significant reduction. Obviously, we want to go to zero, but we are seeing some progress, especially in getting life plans done on time, making sure that people are notified if there's a change in care manager. Please make sure that, one of the common issues is that people, you get a secure email that you're opening those secure emails, and that we are, really changed our practice in making sure there's sufficient notice in the life plan, for the life plan meetings. We are going to do our best at trying to buffer our members and all of you, and if you could work with us on this, because I know there's a lot of things that you all need done in the life planning process for our members in order to be compliant and meet your benchmarks. But we are really going to try to move non-value add, almost the bureaucratic stuff, out of the life plan meeting, so that the life plan meeting can be a more person-centered kind of experience. And all of our care managers are going to get in-person, live, dedicated person-centered training next year, beyond what you would normally do through a Relias or an LMS, but actually in-person workshops. Every single care manager will go through those throughout 2024. So that should also improve some of that. Couple things that we're very proud of. We went through our comprehensive DOH, OPWDD, DQI redesignation for 2023. Both CCOs performed very well. ACA receiving a score of 98.7, Life Plan 100. Those did review all of our policies, processes, health domains from DOH, but then all the person-centered reviews. And we appreciate your help in those person-centered reviews, because we know that as part of that, they're contacting you all, they're contacting the member, the family, and at the end of the day, we would not have scored positively had we both us as well as you were doing the right job for our members. So we appreciate that. Our public profile, you can see that again, we continue to be the second and third largest CCOs. And we continue to enroll members. Both CCOs have had consecutive growth month to month, which means people are asking for us, which is great. We need to make sure that we have trained care managers, which we are doing. We've been very successful at some of our recruitment and retention efforts. Right now, we are both CCOs are fully staffed. And we've revamped our orientation session to ensure that people, after they've gone through the new enrollment process, have qualified care managers. But again, this is a work in progress. And we've talked before, we all share the challenges of working in this very bureaucratic, regulation-driven system. But I think we're starting to make some real progress, especially as we come out of the PHE. And care managers, and this is something that Life Plan and ACA have done very early on, as soon as we could, require care managers to be back person face-to-face and in person. And you know, some of our members are hesitant about that because, again, there's a lot of viruses going around, but we are working with them, taking precautions. And with the ending of the PHE, you know, it's important for us to, again, develop those personal relationships, because you can't do good person-centered planning if the person doesn't know you and feel comfortable with you. Could we advance the slide, please? So again, I've already kind of gotten ahead of myself a little bit in these areas. The Knowledge Center I'll mention, because I've talked about the first three. The Knowledge Center I'm going to mention is another resource that we've been investing in. And that's a member and family resource, but certainly if you all have information that you can add to the Knowledge Center, we'd be more than happy to add it. It's a curated website that is invested in by both person-centered services, ACA, and Life Plan, the three organizations part of the Triad Consortium, to really provide information to families on key topics that they are interested in or they should be aware of, be it transitions, be it employment, guardianships, trusts. And we continue to curate and develop information for the Knowledge Center, because we know that every care manager, you know, when we move to specialization, we are hoping to ensure that the person sitting in front of the member is knowledgeable and knows what's most important to that member. So if you have a member that is medically complex and that is really impacting the quality of their life and the ability for them to receive supports, we want that care manager to understand that specific area. But care managers can't know a lot about everything, no different than any kind of professional. We need to specialize, and then we need to supplement them with other information. And that's where the community resource tool comes in place, which is the compendium of all the resources in the different geographies, but then also the Knowledge Center, which is there to provide people with curated information that would hopefully supplement. So a care manager can say, if you'd like to know more about supported decision-making, please go to this website. By the way, both ACA and Life Plan are leading the charge in supported decision-making. We've got a pilot with Hunter College. We've got trained people who are actually working with our members, and we think that's a very important initiative. So I just want to give a little advertisement for that, because again, it's the state, you know, as we try to think differently about guardianship and the role of supported decision-making, we really want to invest in that. If you could advance to, you know, let's talk a little bit about 2024, and then love to open it up to questions. So one more slide, please. Again, I talked a little bit about the Learning Institute. This is led by, this is the joint investment by ACA and Life Plan. It's led by a PhD, skilled, professional who understands adult learning, has was a director in our care management team, was a care manager, was an MSc, is certified as a housing navigator, certified as a broker. And we've invested subject matter experts as well as people who know how to develop adult learning material to revamp all of our training for care managers, both the certification as well as the specialization. And so they're right now, they've got the whole curriculum developed. We've reviewed it. We've shared it with OPWDD. We're very excited about it. Our care managers are very excited about it because I know when I was a Medicaid service coordinator, you know, one of the things that I wanted to be able to do when I sat in front of somebody is one, understand their needs, know something about what they needed to support them, and then knew the resources in the community. And we think by moving towards this certification model, we'll be assured that everybody has a consistent level of knowledge and practice. But then on top of that, as we specialize people, the individuals sitting in front of our members, sitting with you at the life plan meeting, will have a level of knowledge that is most important to that member. So we'll expand our specialized teams as we train people out. We'll complement some of those specialized teams with our clinical resources because they may be medical or behaviorally focused. We also have a number of QI activities that are focused on improving clinical health outcomes, everything from making sure people have their physicals to having certain tests to being compliant with medication. Again, we're trying to elevate the health outcomes of everyone. And then we are investing with the two CCOs along with person-centered services in exploration in piloting of a portal to provide provider access to key information. That's going to be a major initiative. Again, we serve 45,000 people. And if you think about it, every one of our members might have 2, 3, 4, 5 providers. If you're doing self-direction, you might have a broker, you might have a physical intermediary, you might have somebody who's providing another support. So the number of user IDs for something like Portal, along with the security requirements that we are held to abide by, makes it a little bit more complicated. We're working with our EHR vendor, who like I said, have got a portal developed, and we're going to be piloting it and looking at how we can improve access both to providers as well as to our members. If you could advance, please. And I've talked a little bit about this, and I want to make sure I leave time for Q&A. After all of this investment, a couple key things that we're also doing is we are changing how we measure customer satisfaction. We'll be implementing that fairly soon, probably sometime in the first quarter, end of first quarter of 2024. But it really will be more focused on person-centeredness. And we think that's important, one, to give us valuable feedback in how we're doing the life plan. If the work that we're doing to try to shift some of the activities, we may not be able to eliminate it. You know, one of the things that we always talk about is, and I certainly have had to go through this every year, is, you know, you've got to do the DDP2, you've got to do the CAS, you've got to do the path assessment, or depending on which CCO you're working with and what they call it, either IM or path. And you know, there's a lot of redundancy. We have found that over the last couple of years, the ADMs have added a lot of complexity. The PHE easing has added, you know, when it comes to remote consent, all of those activities that we have to train out care managers basically take up time, and how whether or not we do that for the life, we do it at the life plan, or we do it at another point in the year, we're going to have to figure out how to best do that, because again, we're trying to balance the time of both the member, the family, and the IDT participants. But we'll be able to start measuring whether or not we're making progress in both our care manager certification, the work that we're doing in maybe reallocating how we do some of the work, and then also some of the other things that we're putting in place. So we're going to be implementing that next year. Could you advance? And lastly, I just want to kind of talk a little bit about advocacy, because we know the current system of how we deliver services is not optimal. I know it as a parent. You all know it as either parents, providers, advocates, and certainly our care managers know it. And a lot of the work that care managers do every day is because our system is not working as well as it could or should. And so we're doing advocacy at every level. And I just wanted to share a little bit about that with you. And our provider relations team is great, and they've shared a lot of this with us, what the issues are. So first of all, we're going to continue to promote and support provider agency services. We know that you need better funding for DSPs. You need more flexibility to implement new and innovative programs and services. You are serving many people in spite of the challenges, but we need to do a better job. We also need to facilitate better communication as we work together to advocate for a better system. Couple of areas of focus that we have had, I mentioned health equity. It's a huge issue. We know people with IDD don't get the same level of care as the general population. It's getting more and more challenging to find qualified providers who understand IDD, understand the neuro and genetic diversity of the population, understand how to work with people that may not know their bodies very well or be able to communicate their symptoms. We're struggling with getting people everything from operating room time to behavioral health supports. So we've done a lot of analysis. We've shared a lot of information with all levels of government, be it DOH, OPW, DD, and the second floor. We're also advocating specifically with OPW, DD, that anything that can be done to reduce the bureaucracy of the life plan process be done. Certainly, the redundancy of 3 assessments, some of the complications associated with the ADMs, the life plan document itself is a challenge. I know, having gone through it with my own son. We need to improve how services are accessed and approved. We need to make it easier for agencies to serve people. If a member is requesting an agency to be their fiscal intermediary, they shouldn't be stalled because that fiscal intermediary hasn't been able to get the state contract component of it approved or their contract added to. That should be, we need to have better processes in place. We certainly need to look at, there's some challenges in finding people the right residential supports. A recent study was done that looks at the number of housing opportunities. We've lost over 3,000 of them over the last 5 years. The system is not keeping up with inflation. So we really need to advocate for better investment and more flexibility in how we deliver services. And then lastly, the flexibility of FSS, which used to be a service that we could quickly use to respond to a member's needs, either while they were waiting for waiver services, or maybe if an event took place or an issue took place while they were receiving services. But a lot of that has been taken away, and we've been advocating for that. So those are just a number of the key issues that we've been working on. And there's a number of other ones, working with the Provider Association. I think we have a very common platform with the Provider Association, working together on advancing, better funding and easier access to services. The good news is that we are still getting people through enrollment, albeit sometimes challenging, getting them the psych evals, getting them the the deeming that many people need. But there are new people coming into the system who need your services, and we are advocating and working very hard to get them through eligibility. We've added service access request forms to our EHR to make them easier and ensure that they go through right the first time. So there's a lot of little activities that are going on to kind of promote this as well. I'm going to pause there because I know we have a number of people on the line. I'll also open it up to any of my team if I missed anything that they'd like to add, and then maybe we can answer some questions.
Yeah, thank you, Nick, for that. That was a lot of information covered. It was really great to hear about all the accomplishments that we've made this year with provider relations. I actually do not have a single question in the chat box right now.
Must have answered everything. So while we're waiting, if somebody has a question, I just want to reiterate that, every region, we have a VP of care management. We have 2 senior VPs, one for ACA, one for life plan. We have directors. If you have questions, if you need supports, don't hesitate to reach out to them. If you don't know them, contact your director of provider relations. We have the team of 3 people at each CCO. Megan and Nadir are 2 of those 6 who are there ready to help facilitate an introduction, to help solve a problem. We want to be able to do that. We know that sometimes it's a difficult system to work in, but if we work together, we can improve the quality of life of the people that we serve and maybe reduce some of the stress and the pain that we all as providers, both CCOs and waiver providers and medical providers experience when we're working with this population.
Still pretty quiet out there.
Okay.
I guess.
Well, we're not going to keep anybody longer than we have to. And what I would encourage everybody to do is that if you do have any questions, if you have any concerns, email me, like I said, Director of Provider Relations, any of us. And we appreciate the partnership that we've had with all of you. We all, like I said, serve a common purpose in enhancing the quality of life for people with IDD in New York State. And, we do have a question here. And we want to make sure that that we work together on a collaborative basis.
Sure. So let's see. We do have a question, and that is just how long does it typically take to receive a care manager once you're enrolled in the CCO? Which we can speak to that pretty easily. The date the person's enrolled, that's when we work on assigning the care manager. And I know that involves looking at caseloads and, figuring out the best fit geographically. But if someone from care management wants to jump in, it is that same month that they are enrolled, they should be receiving a care manager, and they do.
And now with the specialized teams, they will first be assigned to the specialized enrollment team, who will help them in developing the person-centered plan, accessing their initial waiver services. Jamie, did you want to share more?
No, you said what I was going to say.
Okay.
And we've got another question in here. Have we received any guidance regarding the reasonable indication of need when applying for HCBS waiver for children? I know that's a tricky topic right now. And I also did get a request for the email, so just letting you know, Nick's email is in that chat box now, but I will turn that question over.
Yeah, I'm going to ask Jamie because I know CCO, we work together with the other CCOs. And Jamie actually is the leader of the CCO leadership team. And I know this has been talked about. So Jamie.
Yeah, I think we are seeing regional differences sometimes, unfortunately, related to what waiver services which regional offices are willing to approve. And they're, I think, intentionally not giving us a definition of what is reasonable, because then we would probably hold them to that a little bit. So there's still variability in it, and the ADM does have some generic language. And all I can say is that we just do our best to advocate, and if it gets denied the first time, come back to the treatment team and to the family and the member and try to figure out how could we make a better case. So Mary Beth, I don't know if you'd add anything to that, but I think we're definitely working region to region, just trying to figure out this approval process, because we're seeing more and more children who want to have access to the waiver, and more we're seeing OPW essentially say, explore other resources first.
So Jamie, I think that that's right. And we still are seeing regional differences. We're trying to work with our care management teams to make sure that their justification is very clear. But still some regions are approving and other regions are very quickly coming back and really asking for what are the natural supports? How are you using family support? And we know for some people and for some families that they really having the waiver supports would be very helpful for them. So we just continue to work, and we have relationships with each regional teams. So we go back really individually with them to say, what's the issue here? But it really is taking time, and in some cases we're not having success.
Yeah, and the other thing I would say to Nick's point, we are working collaboratively with OPWDD to try to bring some clarity to this process, and they are open to at least looking at data collection efforts that we've had around this, and brainstorming solutions. So in that CCO leadership group that Nick just referenced, we have collectively raised it as the 7 CCOs, essentially asking for clarification and also some level of standardization.
And the CCOs are working together to gather information on unmet need and people waiting for services, timelines that people are waiting for services. And we are sharing that back with OPWDD. And we've had, some good interaction with OPWDD through the CCO pre-evaluations that have given us the opportunity to share that.
Megan, I see another question in here around transition times for care managers. And one of the things that Nick mentioned earlier in the presentation is real-time metrics and monitoring of specific things through our quality management plan. And new this year in our plan is a monitoring of transition. We're still trying to figure out the methodology, because sometimes transition happens because people leave the organization. Other times it happens at request of members. And so we want to make sure that when it's requested, it's accommodated. And to the extent that we can, when it's outside of the control of us, we want to make sure we minimize it and at least keep it to a team that knows the member. So this year is the first year we're going to start really monitoring that, so that we can have some better data around how frequently it happens. But the question asks, is there recommendations of how you can help parents? And I think if a parent has a connection to a specific team, if a care manager leaves or if they get moved around, they should definitely escalate it to management, like Nick was talking about. Everybody has a choice in terms of who they're served by. And so if they want to have that conversation with their care management team, they certainly should. So I would definitely recommend and see if there's any continuity we could keep, at least through supervision or, at least location. And the other piece of this is that we have started a program which we will expand, where we're having supervisors actually reach out to members and families, and hopefully through that if a care manager does leave for another opportunity, they'll at least have a relationship with our supervisory team and will feel comfortable as we help families manage that transition. So.
Yeah, and I would add that, the last 4 years have been a challenge because many MSCs that came over may have struggled with the change of job of a care manager, the addition of a lot of complexity, both on the coordination of healthcare, the collection of data, the technology, the tools. So all CCOs have experienced a level of turnover, but then on top of that, all of us, including providers, experienced significant churn during COVID. So while we have put a lot of plans in place and implemented a lot of different initiatives to reduce turnover, and it has come down significantly, because again, you had some people who may have had young children who are now suddenly at home with their children because the school was closed, or we've had people who've had a lot of sickness in their families due to all the viruses, or people just, looking at, well, I went to remote and now I like that. I want to stay remote. Well, the job of a care manager is not to be remote. So now going back into a fully in-person kind of model some people have decided that it's not for them. We're at the point now where most of those people have made that decision. We are up to full staffing. We are monitoring transition of care manager. Some things are outside of our control, but like Jamie said, we're really being thoughtful about how do we limit the amount of change that any member experiences. And when we get to specialization and certification, we do think that enhanced career opportunity will really help our care managers see a career in being a care manager and not just a stop in a different career.
So next question is, when will the specialized teams for new enrollment be implemented? And they already are implemented in a pilot phase at both organizations. The goal is to expand them fully to both teams in the first quarter of 2024.
So we do have a question. Oh, sorry, Jamie. Were you finishing that one up?
Yeah, so that one's an easy one to answer. And by early 2024, everybody who comes through our enrollment process will have that specialized team.
We do have a question from a home care provider asking if there is a direct reach out team that they can contact for new clients. We do have a member outreach team. That's part of our Care Connections team. We can put email information in the chat box to reach them, but you can also reach Care Connections by going to our customer service center. I know that that's not a direct link, but if you go to questions@myacany.org, you can email customer service and they will also connect you to member outreach and Care Connections. I don't know if we have a specific email just for member outreach.
Hi, Megan, I'm going to put in the chat the director of member outreach for each organization.
Great.
And we do have a special QR code that we can distribute to providers via email after this, so that it's very easy to link to. There is a specific number for our outreach teams, and the QR code will take you right to that.
There's also direct links on the website as well, on both websites, to get to enrollment.
Great.
We are listing a lot of resources and outreach. We actually received, Life Plan and ACA received a grant to specifically focus on some of the underrepresented populations, and that's in place, which is important to make people who are not aware of IDD services aware and help them get enrolled, because we know some underrepresented populations, are very, are not aware of the services that we offer, and you can see that in OPWDD demographic information.
Great, Thanks, Nick. We have a question about benefits and entitlements. It says that we used to have an expert in Medicaid, it says, in other benefits that could speak to parents or care managers about the complexities of the programs. Does that person still exist, and how do families and care managers access that expertise? I personally, we do have a benefit access team that supports care management. When I came to ACA, that's actually where I started out in benefits and entitlements. But I don't want to speak for them, so I'll turn that question over.
We do have a benefits and entitlements team, and we also have a subject matter expert who sits within our learning and development team, who is guiding training for all care management. The best way to access it is to go to the care manager, and the care manager can determine which of those team members need to be pulled in. Sometimes that person will help members individually. Sometimes it will be through the care manager. And like Nick started the webinar saying, we have 44,000 people that we have to serve. And so we really do want our care managers to be equipped with the necessary skills to answer the majority of the questions. But if they come across one that's really difficult, they do have access to resources to resolve it with their member.
Let me see. Scrolling through, I don't see any more questions. I do see a comment about getting in touch with supervisor if you're not able to get in touch with the care manager or their supervisor. And if you have a concern with calling the customer service center, you can actually reach the regional directors directly. Their contact information is on our website for every region. I don't know if Mary Beth or let's see, who else is there?
Megan, did we put did you say we put the call center information out?
We did. So that is I put that email in there. It's questions@myacany.org. So they are, again, you can contact the call center, but if you are looking for contact information for one of our regional directors, that's also available on our website.
There's also a questions at Life Plan as well, right?
Yes, both of them, both organizations have questions. And also both organizations do list their supervisor in the email signature at this point. So you could at least get this supervisor, but I believe the websites also list the regional director teams as well.
All right. I think that was the last question that we had.
Well, I'd like to conclude by just thanking everybody. We have over 100 attendees. We know your time is valuable, as I said in the beginning. We appreciate your partnership. We appreciate you and your interest in what we're doing and how we can better work with all of you. So you'll hear more updates from our provider relations team in 2024. We'll continue with our webinars and our email distribution list and our newsletters and certainly our individual visits. I really benefited from the time that I've spent with many providers, and I just want to thank you for your interest in helping us create a better system for our members and their families. Wish you all happy holidays, and we will see you in 2024.